Phlebotomy Certification Exam Practice Test. Question 1. Before collecting a CBC specimen in the outpatient clinic, which action best verifies a conscious patient's identity? Option A. Ask the patient to state full name and date of birth, then compare them with the requisition. Option B. Use the room number as the main identifier. Option C. Label tubes before entering the room. Option D. Ask a visitor to confirm the patient without checking the record. The correct answer is option A. Ask the patient to state full name and date of birth, then compare them with the requisition. Using two identifiers links the specimen to the correct patient before collection. Room numbers are unsafe because patients may be moved or assigned incorrectly. Labeling tubes before collection increases the chance of a mislabeled specimen. A visitor's confirmation does not replace direct identification against the requisition or wristband. Question 2. During hospital unit during morning rounds, how should an unconscious inpatient be identified before venipuncture? Option A. Ask the roommate to identify the patient. Option B. Compare the wristband with the requisition and confirm identity through approved facility procedure. Option C. Proceed because the chart is hanging nearby. Option D. Write unknown on the tube and correct it later. The correct answer is option B. Compare the wristband with the requisition and confirm identity through approved facility procedure. An unconscious patient must still be matched to the order using the wristband and facility-approved verification. A roommate is not a reliable or authorized identifier. A nearby chart can be misplaced or opened to the wrong record. Temporary or delayed labeling creates a serious specimen identification error. Question 3. When a pediatric patient arrives with a guardian for a basic metabolic panel draw, which identification step is most appropriate? Option A. Use only the guardian's last name. Option B. Ask the child to nod if the name sounds familiar. Option C. Verify the child's identifiers on the wristband or record and confirm information with the guardian when permitted. Option D. Skip identification because a parent is present. The correct answer is option C. Verify the child's identifiers on the wristband or record and confirm information with the guardian when permitted. Pediatric identification requires matching the child's identifiers to the order and using the guardian as an added confirmation when appropriate. The guardian's last name alone may not uniquely identify the child. A nod from a child is not a reliable identifier. The presence of a parent or guardian never removes the requirement to verify the patient. Question 4. After filling tubes for a blood culture order, where should the phlebotomist label the specimens? Option A. At the nursing station after collecting several patients. Option B. In the laboratory once the batch arrives. Option C. Before collection so the tubes are ready. Option D. At the bedside or draw site immediately after collection. The correct answer is option D. At the bedside or draw site immediately after collection. Immediate labeling at the draw site preserves the link between the patient and the specimen. Labeling later at a nursing station increases mix-up risk between patients. Waiting until the laboratory receives the batch separates labeling from patient verification. Prelabeling tubes can cause the wrong tube to be used for the wrong patient. Question 5. After reviewing the order, which label detail is essential for a properly collected fasting glucose specimen? Option A. Patient identifiers, collection date and time, and collector identification according to policy. Option B. Only the patient's room number and test name. Option C. Only the physician's name and diagnosis. Option D. Only the tube color and department. The correct answer is option A. Patient identifiers, collection date and time, and collector identification according to policy. A complete specimen label supports patient safety, traceability, and correct laboratory processing. Room number and test name do not uniquely identify the patient or collection event. Physician and diagnosis information cannot replace patient identifiers. Tube color and department do not prove who collected the specimen or when it was collected. Question 6. If a lavender tube reaches the laboratory with no patient label, which response protects patient safety? Option A. Write the patient's name on it from memory. Option B. Reject the specimen and recollect according to facility policy. Option C. Ask the lab to test it quickly before it clots. Option D. Attach any leftover label from the tray. The correct answer is option B. Reject the specimen and recollect according to facility policy. An unlabeled specimen cannot be reliably linked to a patient and is generally unacceptable for testing. Writing from memory is unsafe because memory cannot verify specimen identity. Testing an unlabeled specimen risks reporting results on the wrong patient. Using a leftover label creates a high-risk mislabeling event. Question 7. A patient says they are afraid of needles during a final review in the emergency department bay. How should the phlebotomist respond? Option A. Tell the patient there is nothing to worry about and begin immediately. Option B. Leave the tourniquet on while trying to persuade the patient. Option C. Acknowledge the concern, explain the steps briefly, and position the patient safely. Option D. Ask another patient in the room to reassure them. The correct answer is option C. Acknowledge the concern, explain the steps briefly, and position the patient safely. Calm explanation and safe positioning reduce anxiety while supporting informed cooperation. Dismissing fear can damage trust and may worsen anxiety. Leaving the tourniquet on during a delay can cause hemoconcentration and discomfort. Involving another patient violates privacy and is not a professional response. Question 8. When a competent adult refuses a blood draw for a troponin, which action is most appropriate? Option A. Hold the arm and collect because the test was ordered. Option B. Ask a family member to consent instead. Option C. Label the specimen as refused but collect later without telling the patient. Option D. Respect the refusal, notify the appropriate caregiver, and document according to policy. The correct answer is option D. Respect the refusal, notify the appropriate caregiver, and document according to policy. A competent patient has the right to refuse a procedure, and the refusal must be communicated and documented. Forcing a draw can be considered battery and violates patient rights. A family member cannot override a competent adult's refusal for routine phlebotomy. Collecting later without consent is deceptive and unsafe. Question 9. While explaining a venipuncture in the community health screening event, which statement is most professional? Option A. You may feel a quick pinch, and I will tell you each step as we go. Option B. This will not hurt at all. Option C. Do not move or I will have to stick you again. Option D. I am new, so this might take a long time. The correct answer is option A. You may feel a quick pinch, and I will tell you each step as we go. A brief, honest explanation prepares the patient without increasing fear. Promising no pain is unrealistic and may reduce trust. Threatening language is unprofessional and can heighten anxiety. Announcing inexperience shifts worry to the patient instead of focusing on safe care. Question 10. In the preoperative testing area, which action best protects confidentiality when discussing a patient's hemoglobin A1C order? Option A. Explain the results loudly at the front desk. Option B. Discuss the order only with authorized personnel in a private manner. Option C. Tell a friend that the patient was seen today. Option D. Leave the requisition face up in a public waiting area. The correct answer is option B. Discuss the order only with authorized personnel in a private manner. Confidential information should be shared only for legitimate care purposes and in a private setting. Public discussion can expose protected health information. Sharing a patient's visit with a friend is not authorized. Leaving paperwork visible allows others to see private medical information. Question 11. Before touching collection supplies for an electrolyte panel, why is hand hygiene required? Option A. It sterilizes the needle after opening. Option B. It replaces the need for gloves. Option C. It reduces transfer of microorganisms between the phlebotomist, patient, and equipment. Option D. It is only needed after visible blood exposure. The correct answer is option C. It reduces transfer of microorganisms between the phlebotomist, patient, and equipment. Hand hygiene is a basic infection control step that lowers the risk of transmitting organisms during care. Hand hygiene does not sterilize a needle or any sterile device. Gloves are still needed when blood exposure is possible. Waiting until visible blood exposure misses routine opportunities to prevent contamination. Question 12. To protect patient safety, which principle guides standard precautions during every phlebotomy encounter? Option A. Use precautions only for patients with known infections. Option B. Wear gloves only when the patient requests them. Option C. Skip precautions for routine outpatient draws. Option D. Treat all blood and potentially infectious body fluids as capable of transmitting infection. The correct answer is option D. Treat all blood and potentially infectious body fluids as capable of transmitting infection. Standard precautions assume that blood may carry infectious organisms regardless of diagnosis. Known infection status is not enough because some infections are undiagnosed. Glove use is based on exposure risk, not patient preference alone. Routine outpatient draws still involve blood exposure risk. Question 13. After removing gloves following a bilirubin draw, which step should occur next? Option A. Perform hand hygiene immediately. Option B. Use the same gloves for the next patient. Option C. Touch the computer keyboard before cleaning hands. Option D. Place gloves in the sharps container. The correct answer is option A. Perform hand hygiene immediately. Hand hygiene after glove removal removes organisms that may be present from glove contamination or removal. Reusing gloves transfers contamination between patients. Touching shared equipment before hand hygiene can contaminate surfaces. Gloves belong in regular biohazard waste when contaminated, not in the sharps container. Question 14. In a contact precaution room, which added protection is commonly required before collecting blood? Option A. No PPE because blood collection is brief. Option B. Gown and gloves according to the isolation signage. Option C. Only a surgical mask for every contact patient. Option D. Sterile gloves and no gown for all patients. The correct answer is option B. Gown and gloves according to the isolation signage. Contact precautions commonly require gown and gloves to prevent transfer of organisms from the patient or environment. Brief contact can still contaminate clothing or hands. A surgical mask is not the defining PPE for contact precautions. Sterile gloves are not required for routine venipuncture unless a sterile procedure is indicated. Question 15. For an airborne isolation patient needing a lactate, which respiratory protection is typically required? Option A. Only clean exam gloves. Option B. A cloth face covering from home. Option C. A fit-tested N95 respirator or facility-approved equivalent. Option D. No respiratory protection if the draw is under 1 minute. The correct answer is option C. A fit-tested N95 respirator or facility-approved equivalent. Airborne precautions require respiratory protection capable of filtering airborne particles according to facility policy. Gloves protect hands but do not protect against airborne inhalation. A cloth face covering is not equivalent to an approved respirator for airborne isolation. Short exposure time does not remove the need for required respiratory protection. Question 16. During a droplet precaution blood draw, which PPE item is especially important when close to the patient's face? Option A. Lead apron. Option B. Sterile shoe covers only. Option C. No mask if gloves are worn. Option D. A surgical mask or facility-approved face protection. The correct answer is option D. A surgical mask or facility-approved face protection. Droplet precautions focus on preventing exposure to respiratory droplets during close patient contact. A lead apron protects from radiation, not droplets. Shoe covers alone do not protect mucous membranes from droplets. Gloves protect hands but do not replace facial protection. Question 17. After activating the needle safety device, where should the used needle be placed? Option A, immediately into an approved sharps container. Option B, on the tray until the draw is finished. Option C, in a regular trash bag if capped. Option D, in the biohazard bag with gauze. The correct answer is option A. Immediately into an approved sharps container. Used needles must go directly into a puncture-resistant sharps container to prevent injury. Leaving a needle on the tray exposes staff and patients to accidental sticks. Regular trash is not puncture-resistant and is unsafe for sharps. Soft biohazard bags are not designed to contain needles. Question 18. If a phlebotomist sustains a needle stick during a study session, which action should happen first? Option A, finish all remaining patients before reporting. Option B, wash the area immediately and follow the facility exposure reporting procedure. Option C, recap the needle to identify its size. Option D, ignore it if the patient looks healthy. The correct answer is option B. Wash the area immediately and follow the facility exposure reporting procedure. Immediate cleansing and prompt reporting support timely exposure evaluation and follow-up. Delaying the report can delay medical assessment and documentation. Recapping increases sharps injury risk and is not needed to report the exposure. Appearance does not determine whether a blood-borne pathogen risk exists. Question 19. Why should contaminated needles generally not be recapped after venipuncture? Option A. It causes all specimens to hemolyze. Option B. It changes the additive in the tube. Option C, recapping creates a preventable sharps injury risk. Option D. It makes the tourniquet too tight. The correct answer is option C. Recapping creates a preventable sharps injury risk. Recapping requires bringing the hand back toward the contaminated sharp, which increases needle stick risk. Hemolysis is affected by collection and handling factors, not by recapping alone. Tube additives are not changed by whether a needle is recapped. Tourniquet tightness is unrelated to needle recapping. Question 20. When a sharps container is near the fill line in the long-term care unit, which action is safest? Option A, push the contents down to make space. Option B, place extra needles in a biohazard bag. Option C, continue using it until the lid will not close. Option D, replace or close it according to facility policy before it becomes overfilled. The correct answer is option D. Replace or close it according to facility policy before it becomes overfilled. Sharps containers must not be overfilled because protruding sharps can cause injury. Pushing contents down places hands near contaminated sharps. Biohazard bags do not provide puncture protection for needles. Waiting until the lid fails creates an avoidable exposure hazard. Question 21. After reviewing the order, which item is an engineering control used to reduce blood-borne pathogen exposure? Option A. A safety engineered needle with a protective device. Option B. A reminder poster only. Option C. A handwritten exposure note. Option D. A longer tourniquet. The correct answer is option A. A safety engineered needle with a protective device. Engineering controls isolate or remove the hazard through device design, such as safety needles. A poster may educate staff but does not physically control the sharp. A note documents information but does not prevent exposure. Tourniquet length does not protect against needle stick injuries. Question 22. During a blood spill cleanup, which approach is most appropriate? Option A. Wipe the spill with dry paper towels only. Option B. Wear proper PPE and use an approved disinfectant according to policy. Option C. Ask a patient to avoid the area and leave it. Option D. Use bare hands if the spill is small. The correct answer is option B. Wear proper PPE and use an approved disinfectant according to policy. Blood spills require PPE and proper disinfection because blood may contain infectious material. Dry towels alone do not disinfect contaminated surfaces. Leaving the spill exposes others to contamination. Bare hands create direct exposure risk even with small spills. Question 23. In a routine phlebotomy scenario, which resource should be checked for safe handling information about a chemical disinfectant? Option A. The patient's wristband. Option B. The order of draw chart. Option C. The safety data sheet. Option D. The tube expiration label only. The correct answer is option C. The safety data sheet. A safety data sheet explains chemical hazards, PPE, storage, and spill response. A wristband identifies the patient but gives no chemical safety guidance. An order of draw chart does not address disinfectant hazards. A tube label may show expiration but not chemical handling instructions. Question 24. Before proceeding with the draw, which vein is usually preferred for routine venipuncture in an adult antecubital area? Option A. Basilic vein as the first choice. Option B. Femoral artery. Option C. Vein on the underside of the wrist. Option D. Median cubital vein. The correct answer is option D. Median cubital vein. The median cubital vein is commonly preferred because it is usually well anchored and less likely to roll. The basilic vein is closer to nerves and arteries and is usually not the first choice. The femoral artery is not a routine venipuncture site for phlebotomists. The underside of the wrist has higher risk for nerve or tendon injury. Question 25. How should the needle bevel generally be positioned when entering a vein? Option A. Bevel up at an appropriate shallow angle. Option B. Bevel down at a steep angle. Option C. Sideways with the tube already removed. Option D. Flat against the skin without entering. The correct answer is option A. Bevel up at an appropriate shallow angle. A bevel up approach helps the needle enter the vein smoothly and supports blood flow into the collection system. A bevel down steep approach can increase discomfort and may pass through the vein. A sideways needle position is unstable and not standard technique. A needle flat against the skin will not properly access the vein. Question 26. At what angle is a routine venipuncture needle commonly inserted? Option A. About 5 degrees for every adult. Option B. About 15 to 30 degrees. Option C. About 60 to 90 degrees. Option D. Parallel under the skin for several inches. The correct answer is option B. About 15 to 30 degrees. A 15 to 30 degree angle is commonly used to enter the vein without going too deep. A very shallow angle may fail to enter the vein or may drag under the skin. A 60 to 90 degree angle is more likely to puncture through the vein. Advancing parallel for several inches increases tissue trauma and is not standard venipuncture. Question 27. Before inserting the needle for a therapeutic drug level, why should the selected vein be anchored? Option A. It sterilizes the skin. Option B. It replaces the need to cleanse the site. Option C. Anchoring stabilizes the vein and reduces rolling during entry. Option D. It allows the tourniquet to stay on longer. The correct answer is option C. Anchoring stabilizes the vein and reduces rolling during entry. Anchoring stretches the skin and helps keep the vein steady as the needle enters. Anchoring does not sterilize skin or remove microorganisms. Skin cleansing is still required before puncture. Anchoring does not justify prolonged tourniquet time. Question 28. After cleansing a venipuncture site with alcohol, when should the needle be inserted? Option A, immediately while the alcohol is wet. Option B, after blowing on the site. Option C, after wiping the area with a used gauze pad. Option D, after the site air dries completely. The correct answer is option D, after the site air dries completely. Allowing alcohol to air dry improves antisepsis and reduces stinging and hemolysis risk. Puncturing through wet alcohol can sting and may affect specimen quality. Blowing on the site contaminates the cleaned area. Used gauze can reintroduce microorganisms to the puncture site. Question 29. How long should a tourniquet generally remain in place before it risks hemoconcentration? Option A, no longer than about 1 minute. Option B, at least 5 minutes for every draw. Option C, until all labels are printed. Option D, only after the patient pumps the fist repeatedly. The correct answer is option A, no longer than about 1 minute. Tourniquet application beyond about 1 minute can concentrate blood components and alter some results. 5 minutes is excessive and can distort laboratory values. Administrative delays do not justify prolonged tourniquet use. Repeated fist pumping can also contribute to hemoconcentration. Question 30. When should the tourniquet be released during routine tube collection? Option A, only after the patient leaves. Option B, as soon as blood flow is established and before removing the needle, following policy. Option C, before the needle ever enters the skin in every case. Option D, after 5 minutes to improve the specimen. The correct answer is option B, as soon as blood flow is established and before removing the needle, following policy. Releasing the tourniquet once blood flow is established helps reduce hemoconcentration and patient discomfort. Leaving it on until the patient leaves is unsafe and unnecessary. Removing it before needle entry in every case may make vein access difficult. Prolonged application does not improve specimen quality. Question 31. Why should patients avoid repeatedly pumping the fist during venipuncture? Option A, it sterilizes the collection site. Option B, it prevents all hematomas. Option C, it may alter analytes such as potassium through hemoconcentration and muscle activity. Option D, it guarantees faster clotting in citrate tubes. The correct answer is option C. It may alter analytes such as potassium through hemoconcentration and muscle activity. Repeated fist pumping can change blood composition and affect certain test results. Fist pumping has no antiseptic effect on the skin. Hematoma prevention depends on technique and post-draw pressure, not fist pumping. Citrate tubes are anticoagulated and do not rely on patient fist motion. Question 32. Before proceeding with the draw, which needle gauge is commonly used for routine adult venipuncture with evacuated tubes? Option A, 12 gauge needle. Option B, 30 gauge needle for all adults. Option C, a lancet designed for heel stick only. Option D, 21 or 22 gauge needle. The correct answer is option D, 21 or 22 gauge needle. A 21 or 22 gauge needle usually provides adequate flow while limiting trauma for routine adult veins. A 12 gauge needle is unnecessarily large and traumatic for routine phlebotomy. A 30 gauge needle is too small for standard evacuated tube collection and may slow flow. A heel stick lancet is not used for routine venipuncture. Question 33. For a patient with a small fragile hand vein, which device may improve control? Option A, winged infusion set with appropriate tube or syringe technique. Option B, large bore blood donation needle. Option C, heel puncture lancet. Option D, unprotected straight needle used without a holder. The correct answer is option A, winged infusion set with appropriate tube or syringe technique. A winged infusion set offers better control for small or fragile veins when used according to policy. A large bore donation needle is excessive and can injure a small vein. A heel puncture lancet is for dermal puncture, not accessing a hand vein. Using an unprotected straight needle without a holder is unsafe and not standard practice. Question 34. When a butterfly set is used for a coagulation tube, why may a discard tube be needed first? Option A. The discard tube warms the patient's arm. Option B. The tubing airspace can underfill the citrate tube and disturb the blood to additive ratio. Option C. The discard tube removes EDTA carryover from the skin. Option D. The discard tube replaces patient identification. The correct answer is option B. The tubing airspace can underfill the citrate tube and disturb the blood to additive ratio. Coagulation testing requires a properly filled citrate tube, and butterfly tubing can contain air that affects fill volume. A discard tube is not used to warm the arm. EDTA carryover is managed by order of draw, not by removing it from the skin. No tube can replace proper patient identification. Question 35. If no blood enters the tube after needle insertion, which action is safest first? Option A. Probe deeply until blood appears. Option B. Turn the needle in circles under the skin. Option C. Gently adjust needle position while staying within policy and patient comfort limits. Option D. Leave the needle in place while searching for another vein. The correct answer is option C. Gently adjust needle position while staying within policy and patient comfort limits. Small, controlled adjustment may correct positioning without excessive tissue trauma. Deep probing increases pain, hematoma risk, and nerve injury risk. Rotating the needle under the skin is traumatic and not appropriate. A needle should not be left in one site while searching elsewhere. Question 36. A patient reports sharp, electric pain down the arm during needle insertion. What should the phlebotomist do? Option A. Advance deeper to pass the nerve. Option B. Ask the patient to ignore it until the tube fills. Option C. Release pressure only after all tubes are collected. Option D. Stop the draw, remove the needle safely, and follow facility procedure. The correct answer is option D. Stop the draw, remove the needle safely, and follow facility procedure. Sharp radiating pain can indicate nerve irritation or injury, so the draw should be stopped promptly. Advancing deeper can worsen nerve injury. Ignoring the symptom places the patient at unnecessary risk. Continuing tube collection delays the response to a possible complication. Question 37. During a difficult draw, why should excessive probing be avoided? Option A. It increases pain, hematoma risk, and possible nerve or tissue injury. Option B. It improves all specimen results. Option C. It sterilizes the vein. Option D. It prevents the need for patient identification. The correct answer is option A. It increases pain, hematoma risk, and possible nerve or tissue injury. Excessive needle movement can damage tissue and compromise patient safety. Probing does not improve laboratory accuracy. Needle movement has no sterilizing effect. Patient identification is always required regardless of draw difficulty. Question 38. If a vein collapses during evacuated tube collection, which change may help on a redraw? Option A. Use a stronger vacuum tube on the same fragile vein. Option B. Use a smaller tube, syringe, or winged set according to policy. Option C. Keep the tourniquet on for several minutes. Option D. Tell the patient to pump the fist continuously. The correct answer is option B. Use a smaller tube, syringe, or winged set according to policy. Reducing vacuum or improving control can help fragile veins tolerate collection. A stronger vacuum can worsen collapse. Prolonged tourniquet time can alter results and increase discomfort. Continuous fist pumping may affect analytes and does not solve vein collapse. Question 39. In a routine phlebotomy scenario, which site should generally be avoided unless specifically approved by policy or provider order? Option A. A well-palpated median cubital vein. Option B. An acceptable dorsal hand vein. Option C. A foot or ankle vein. Option D. A suitable cephalic vein. The correct answer is option C. A foot or ankle vein. Foot or ankle draws carry higher complication risk and often require special approval. The median cubital vein is a common routine site when suitable. A dorsal hand vein may be acceptable when antecubital veins are unavailable. The cephalic vein can be appropriate when assessed carefully. Question 40. Why should an arm with a dialysis fistula usually be avoided for routine venipuncture? Option A. The blood in that arm has no cells. Option B. All tubes drawn from that arm turn blue. Option C. It eliminates the need for a tourniquet. Option D. The fistula must be protected from injury, infection, and altered blood flow. The correct answer is option D. The fistula must be protected from injury, infection, and altered blood flow. A dialysis access site is medically important and should not be used for routine blood collection without specific authorization. Blood in the arm still contains cells. Tube color is determined by the collection container, not the arm. Tourniquet decisions do not remove the risk to a fistula. Question 41. Why is the site of a prior mastectomy often avoided for venipuncture? Option A. Lymphatic changes can increase risk for swelling, infection, or complications. Option B. The veins always contain arterial blood. Option C. The skin cannot be cleaned. Option D. All specimens from that side clot immediately. The correct answer is option A. Lymphatic changes can increase risk for swelling, infection, or complications. Mastectomy with lymph node involvement can affect lymph drainage, so the opposite arm is preferred when possible. Venous blood does not become arterial because of mastectomy history. The issue is not an inability to cleanse skin. Specimens do not automatically clot because of collection side. Question 42. When N4 is running in one arm, which collection choice is usually preferred? Option A. Draw above the 4 site while fluid is running. Option B. Use the opposite arm when available and follow facility policy. Option C. Collect directly through the 4 tubing without authorization. Option D. Ignore the 4 because additives prevent contamination. The correct answer is option B. Use the opposite arm when available and follow facility policy. Using the opposite arm helps prevent dilution or contamination from 4 fluids. Drawing above a running 4 can contaminate or dilute the specimen. Line draws require authorization and specific procedure. Tube additives do not correct 4 fluid contamination. Question 43. For a bilirubin collection, which finding makes a venipuncture site a poor choice? Option A. A vein that is palpable and resilient. Option B. Clean intact skin over an antecubital vein. Option C. Edema, burns, scarring, or signs of infection at the site. Option D. A site that allows safe patient positioning. The correct answer is option C. Edema, burns, scarring, or signs of infection at the site. Compromised tissue can affect specimen quality and increase patient risk, so another site should be chosen. A palpable resilient vein is generally a favorable finding. Clean intact skin supports safe site preparation. Safe positioning is desirable for venipuncture. Question 44. A swelling begins forming around the puncture site during collection. What should the phlebotomist suspect? Option A. Proper tube mixing. Option B. Successful fasting status. Option C. Normal clot retraction in the vein. Option D. Hematoma formation. The correct answer is option D. Hematoma formation. Swelling during a draw suggests blood is leaking into surrounding tissue, forming a hematoma. Tube mixing happens after collection and does not cause local swelling. Fasting status cannot be determined by puncture site swelling. Clot retraction is a laboratory process, not a normal event around an active needle site. Question 45. If a hematoma starts to develop during venipuncture, which action is appropriate? Option A. Release the tourniquet, remove the needle, and apply pressure. Option B. Continue filling all ordered tubes. Option C. Massage the swollen area vigorously. Option D. Ask the patient to bend the elbow tightly. The correct answer is option A. Release the tourniquet, remove the needle, and apply pressure. Stopping the draw and applying pressure limits further bleeding into the tissue. Continuing the draw can enlarge the hematoma. Vigorous massage can worsen bruising and tissue injury. Bending the elbow can increase bruising and does not provide focused pressure. Question 46. A patient becomes pale and says they feel dizzy during a blood draw. Which response is safest? Option A. Ask the patient to stand up and walk it off. Option B. Stop the draw, remove the needle, lower the patient's head or position safely, and seek help as needed. Option C. Leave the needle in while getting more tubes. Option D. Give the patient food before removing the needle. The correct answer is option B. Stop the draw, remove the needle, lower the patient's head or position safely, and seek help as needed. Dizziness may signal syncope, so the priority is preventing injury and stopping the procedure safely. Standing can lead to a fall. Leaving the needle in place while symptoms progress increases injury risk. Food is not the first action while a needle is still in the arm. Question 47. After drawing a patient who takes anticoagulants, what post-puncture step is especially important? Option A. Skip pressure to avoid bruising. Option B. Ask the patient to bend the elbow sharply. Option C. Apply firm pressure longer and verify bleeding has stopped before bandaging. Option D. Use the same bandage time for every patient without checking. The correct answer is option C. Apply firm pressure longer and verify bleeding has stopped before bandaging. Patients on anticoagulants may bleed longer, so pressure and reassessment help prevent continued bleeding or bruising. Skipping pressure increases bleeding risk. Bending the elbow can promote bruising instead of controlled pressure. A fixed time without checking may miss ongoing bleeding. Question 48. Before proceeding with the draw, which action helps prevent a hematoma after removing the needle? Option A. Have the patient bend the elbow tightly. Option B. Rub the puncture site to spread the blood. Option C. Remove the needle before releasing the tourniquet every time. Option D. Apply clean gauze with firm pressure while the arm remains straight. The correct answer is option D. Apply clean gauze with firm pressure while the arm remains straight. Focused pressure with the arm straight helps seal the puncture site and limit bruising. Bending the elbow may increase leakage into tissue. Rubbing can disrupt clot formation and worsen bruising. The tourniquet should be released before needle removal to reduce pressure in the vein. Question 49. Bright red pulsating blood appears unexpectedly during a draw. Which concern should the phlebotomist consider? Option A. Possible arterial puncture. Option B. Proper venous flow. Option C. Tube additive carryover. Option D. Normal capillary refill. The correct answer is option A. Possible arterial puncture. Pulsating bright red blood can indicate arterial access and requires stopping the procedure and applying pressure. Typical venous flow is darker and not pulsatile. Additive carryover affects specimen chemistry, not blood pulsation. Capillary refill is assessed in tissue color return, not tube blood flow. Question 50. In the long-term care unit, which tube is collected first when blood cultures are ordered with other venipuncture tubes? Option A. Lavender EDTA tube. Option B. Blood culture bottles or sterile culture tube. Option C. Gray fluoride tube. Option D. Serum separator tube. The correct answer is option B. Blood culture bottles or sterile culture tube. Blood cultures are collected first to reduce contamination of the sterile specimen. EDTA tubes are collected later to prevent additive carryover. Gray tubes are generally collected after other additive tubes. Serum separator tubes do not take priority over sterile blood culture collection. Question 51. In the standard venipuncture order of draw, which tube usually follows blood cultures? Option A, lavender EDTA tube. Option B, gray fluoride tube. Option C, light blue sodium citrate tube. Option D, royal blue tube for every test. The correct answer is option C, light blue sodium citrate tube. The light blue citrate tube is collected early to protect coagulation testing from additive contamination. EDTA is collected later because it can interfere with coagulation and chemistry tests. Gray fluoride tubes are usually near the end of the order. Royal blue tubes are used for specific trace element testing, not as the universal second tube. Question 52. To protect patient safety, which order is most appropriate for collecting blood cultures, light blue, serum, green, lavender, and gray tubes? Option A, lavender, gray, green, serum, light blue, blood cultures. Option B, gray, lavender, green, serum, light blue, blood cultures. Option C, serum, lavender, blood cultures, gray, light blue, green. Option D, blood cultures, light blue, serum, green, lavender, gray. The correct answer is option D, blood cultures, light blue, serum, green, lavender, gray. The standard order minimizes additive carryover by collecting sterile cultures first, citrate early, then serum, heparin, EDTA, and glycolytic inhibitor tubes. Starting with lavender risks EDTA contamination of later tubes. Starting with gray places fluoride/oxalate before tubes that could be affected by carryover. Placing cultures after non-sterile tubes increases contamination risk. Question 53. Why does order of draw matter during evacuated tube collection? Option A. It helps prevent additive carryover from altering later specimens. Option B. It makes patient identification optional. Option C. It eliminates the need to mix tubes. Option D. It determines the patient's fasting status. The correct answer is option A. It helps prevent additive carryover from altering later specimens. Additives from one tube can contaminate another tube if collection order is incorrect. Patient identification is required regardless of tube order. Additive tubes still need proper mixing after filling. Fasting status is based on patient preparation, not tube sequence. Question 54. During capillary puncture, which specimen type is generally collected first when ordered? Option A, serum specimen. Option B, blood gas specimen. Option C, gray top microtube. Option D, non-additive tube after all others. The correct answer is option B, blood gas specimen. Capillary specimens are collected in an order that protects tests most affected by clotting and air exposure, with blood gases first when required. Serum is not first when blood gases are ordered. Gray microtubes are collected after more time-sensitive capillary specimens. Non-additive tubes are not automatically collected first in capillary order. Question 55. In a routine phlebotomy scenario, which capillary collection order is commonly used after blood gases when EDTA testing is ordered? Option A, serum microtube before EDTA for every draw. Option B, gray microtube first even when blood gases are needed. Option C, EDTA microtube before other additive and serum microtubes. Option D. Any order because capillary tubes have no additives. The correct answer is option C, EDTA microtube before other additive and serum microtubes. EDTA microtubes are collected early in capillary collection to reduce clotting in hematology specimens. Serum first collection can allow clotting before the EDTA specimen is filled. Blood gases are more time sensitive and generally come first if ordered. Many capillary tubes contain additives, so order still matters. Question 56. Before proceeding with the draw, which tube is most appropriate for a routine CBC? Option A, light blue sodium citrate tube. Option B, gray sodium fluoride tube. Option C, red no additive tube. Option D, lavender top tube containing EDTA. The correct answer is option D. Lavender top tube containing EDTA. EDTA preserves cellular morphology and prevents clotting for hematology testing such as CBC. Citrate is used mainly for coagulation testing. Gray tubes are commonly used for glucose or lactate preservation. A red tube allows serum testing and is not the standard choice for CBC. Question 57. During a final review, which additive is found in a light blue tube used for patient and APTT testing? Option A, sodium citrate. Option B, EDTA. Option C, sodium fluoride with potassium oxalate. Option D, lithium heparin. The correct answer is option A. Sodium citrate. Sodium citrate binds calcium in a controlled ratio so coagulation testing can be performed accurately. EDTA is used mainly for hematology and can interfere with coagulation testing. Fluoride/oxalate is used mainly to preserve glucose or lactate. Heparin is used for plasma chemistry tests rather than routine patient or APTT tubes. Question 58. In the Student Skills Lab, which tube is commonly selected for many serum chemistry tests when gel separation is desired? Option A, lavender EDTA tube. Option B, serum separator tube with clot activator and gel. Option C, light blue citrate tube. Option D, gray fluoride tube only. The correct answer is option B. Serum separator tube with clot activator and gel. A serum separator tube allows clotting and then separates serum from cells using gel after centrifugation. EDTA plasma is not serum and can interfere with some chemistry tests. Citrate plasma is intended primarily for coagulation testing. Gray tubes preserve glucose but are not the general serum separator choice. Question 59. For a ammonia collection, which tube is commonly associated with heparinized plasma chemistry testing? Option A, lavender top tube. Option B, light blue top tube. Option C, green top tube. Option D, pink top tube. The correct answer is option C. Green top tube. Green top tubes commonly contain heparin, which prevents clotting and provides plasma for chemistry testing. Lavender tubes contain EDTA for hematology. Light blue tubes contain citrate for coagulation testing. Pink tubes contain EDTA and are commonly used for blood bank testing. Question 60. To protect patient safety, which tube is most commonly used for glucose preservation when testing may be delayed? Option A, plain red tube only. Option B, light blue citrate tube. Option C, blood culture bottle. Option D, gray top tube with sodium fluoride and an anticoagulant. The correct answer is option D. Gray top tube with sodium fluoride and an anticoagulant. Sodium fluoride inhibits glycolysis, helping preserve glucose concentration before analysis. A plain red tube does not contain glycolysis inhibitor. Citrate is used for coagulation studies, not routine glucose preservation. Blood culture bottles are for detecting microorganisms, not preserving glucose. Question 61. After reviewing the order, which tube is commonly used for blood bank testing such as type and screen? Option A, pink top EDTA tube. Option B, gray top fluoride tube. Option C, light blue citrate tube. Option D, green heparin tube for every blood bank test. The correct answer is option A. Pink top EDTA tube. Pink top EDTA tubes are commonly used for blood bank specimens because they preserve cells and prevent clotting. Gray tubes are associated with glucose or lactate preservation. Light blue citrate tubes are for coagulation testing. Green heparin tubes are not the routine tube for type and screen. Question 62. When preparing for collection, which tube is generally collected for a blood culture specimen? Option A, lavender EDTA tube only. Option B, sterile blood culture bottle or SBS containing culture tube according to policy. Option C, gray fluoride tube. Option D, SST after clotting. The correct answer is option B. Sterile blood culture bottle or SBS containing culture tube according to policy. Blood cultures require sterile collection into a culture system designed to support organism recovery. A lavender tube is not designed as the primary blood culture container. A gray tube preserves glucose and does not support blood culture protocols. An SST is for serum separation, not microorganism culture. Question 63. Why must a light blue citrate tube be filled to the proper level? Option A. The tube color changes if underfilled. Option B, EDTA needs extra room to mix. Option C. The blood to anticoagulant ratio must be correct for coagulation results. Option D, serum cannot clot unless the tube is full. The correct answer is option C. The blood to anticoagulant ratio must be correct for coagulation results. Coagulation testing depends on a precise citrate to blood ratio, commonly described as 1 part citrate to 9 parts blood. Tube color does not change to warn of underfilling. EDTA is not the additive in a light blue citrate tube. Light blue tubes contain anticoagulant and are not collected to obtain serum clotting. Question 64. After collecting an additive tube, how should it usually be mixed? Option A, shake it hard until bubbles appear. Option B, leave it unmixed until centrifugation. Option C, open the stopper and stir with a wooden applicator. Option D, gently invert the tube the recommended number of times. The correct answer is option D. Gently invert the tube the recommended number of times. Gentle inversion evenly distributes additive while reducing cell trauma. Vigorous shaking can cause hemolysis. Failure to mix can allow clotting or poor additive action. Opening a tube risks exposure, contamination, and specimen loss. Question 65. During a scenario, which problem can occur if a lavender EDTA tube is not mixed soon after filling? Option A, microclots may form and make hematology results unreliable. Option B. The tube becomes sterile for culture. Option C. The specimen turns into serum. Option D. The sodium citrate ratio improves. The correct answer is option A. Microclots may form and make hematology results unreliable. EDTA must contact the blood promptly to prevent clot formation in hematology specimens. Mixing does not create sterility for culture testing. A lavender tube is intended for anticoagulated whole blood or plasma, not serum. Sodium citrate is not the additive in a lavender EDTA tube. Question 66. In the mobile collection site, which practice helps reduce hemolysis during a routine type and screen collection? Option A, force blood rapidly through a small needle. Option B, use appropriate needle size and gently invert tubes instead of shaking them. Option C, shake additive tubes vigorously. Option D, pull back a syringe plunger as hard as possible. The correct answer is option B. Use appropriate needle size and gently invert tubes instead of shaking them. Gentle handling and appropriate equipment reduce red blood cell rupture. Forcing blood through a small needle can damage cells. Vigorous shaking is a common cause of hemolysis. Excessive syringe force can rupture cells and compromise results. Question 67. For a lipid panel collection, which laboratory result is especially affected by hemolysis because red cells release intracellular contents? Option A, patient date of birth becomes invalid. Option B, tube expiration date is extended. Option C, potassium may be falsely increased. Option D. Tourniquet pressure becomes lower. The correct answer is option C. Potassium may be falsely increased. Hemolysis releases intracellular potassium from red blood cells and can falsely elevate measured potassium. Patient demographics are not changed by cell rupture. A specimen problem cannot extend tube expiration. Tourniquet pressure is unrelated to the analyzer result after hemolysis. Question 68. When using a syringe for blood transfer, which method best protects specimen quality? Option A. Remove the tube stopper and push blood in forcefully. Option B. Squirt blood through the needle into each tube. Option C. Shake each tube hard to remove clots. Option D. Use a safety transfer device and allow blood to flow gently into tubes. The correct answer is option D. Use a safety transfer device and allow blood to flow gently into tubes. A safety transfer device reduces needle stick risk and minimizes pressure-related cell damage. Removing stoppers increases exposure and contamination risk. Pushing blood through a needle can cause hemolysis and Sharp's injury. Shaking tubes can rupture cells and worsen specimen quality. Question 69. Why should alcohol be allowed to dry before puncture? Option A. Wet alcohol can cause stinging and may contribute to hemolysis or specimen contamination. Option B. Dry alcohol makes the tube additive stronger. Option C. Wet alcohol improves vein anchoring. Option D. Alcohol drying replaces tourniquet use. The correct answer is option A. Wet alcohol can cause stinging and may contribute to hemolysis or specimen contamination. Air drying supports proper antisepsis and prevents wet alcohol from entering the specimen path. Drying does not change the chemical strength of tube additives. Vein anchoring depends on hand technique, not wet alcohol. Tourniquet use is a separate step for vein distension. Question 70. When preparing for collection, which specimen often requires protection from light after collection? Option A. CBC specimen for platelet count. Option B. Bilirubin specimen. Option C. Routine sodium citrate coagulation tube. Option D. Blood culture bottle during incubation. The correct answer is option B. Bilirubin specimen. Bilirubin is light sensitive and may decrease if the specimen is exposed to light. CBC specimens require mixing and timely testing, not routine light protection for platelet count. Citrate coagulation specimens require correct fill and processing, not light protection as the key issue. Blood cultures require sterile handling and incubation, not wrapping for light protection as the primary step. Question 71. In a routine phlebotomy scenario, which specimen commonly requires rapid transport on ice or chilled handling according to policy? Option A. Routine CBC kept for the next day. Option B. Serum separator tube for a lipid panel after clotting only. Option C. Ammonia specimen. Option D. Blood culture bottle placed in the freezer. The correct answer is option C. Ammonia specimen. Ammonia specimens are time-sensitive and commonly require chilling and prompt processing. A routine CBC should not simply be held for the next day without stability guidance. A lipid panel does not share the same immediate chilled handling requirement as ammonia. Blood culture bottles should not be frozen because organisms must remain viable for detection. Question 72. Before proceeding with the draw, which action best maintains specimen integrity during transport to the laboratory? Option A. Store every specimen at room temperature overnight. Option B. Centrifuge every tube immediately regardless of type. Option C. Place all blood specimens in direct sunlight. Option D. Follow required time, temperature, light, and handling instructions for the ordered test. The correct answer is option D. Follow required time, temperature, light, and handling instructions for the ordered test. Different tests have specific stability requirements, so handling must match the test and facility policy. Overnight room temperature storage can make many specimens unacceptable. Some tubes should not be centrifuged immediately or at all before required steps. Sunlight can degrade light-sensitive analytes and warm specimens. Question 73. If a specimen must be transported cold, which approach is appropriate? Option A. Place the specimen in the approved cooling method without direct water contamination. Option B. Submerge the tube in loose ice water. Option C. Hold it in a bare hand to keep it visible. Option D. Place it near a heater until pickup. The correct answer is option A. Place the specimen in the approved cooling method without direct water contamination. Cooling must preserve the required temperature while protecting the label and tube from contamination or leakage. Loose ice water can damage labels and create contamination issues. Holding the specimen warms it and defeats the cold requirement. A heater can destabilize temperature-sensitive analytes. Question 74. In the occupational health clinic, which situation is a common reason for specimen rejection? Option A. Collector wore gloves. Option B. Wrong tube type or insufficient specimen volume. Option C. Patient stated date of birth. Option D. Tube was labeled at the bedside. The correct answer is option B. Wrong tube type or insufficient specimen volume. Wrong container choice or inadequate volume can prevent accurate testing and may require recollection. Wearing gloves is expected when blood exposure is possible. Patient-stated identifiers support accurate identification. Bedside labeling is the correct practice. Question 75. Why should tube expiration dates be checked before collection? Option A. Expired tubes identify patients faster. Option B. Expired tubes prevent hemolysis in every case. Option C. Expired tubes may have inadequate vacuum or unreliable additive performance. Option D. Expired tubes are required for coagulation testing. The correct answer is option C. Expired tubes may have inadequate vacuum or unreliable additive performance. Tube vacuum and additive quality can decline after expiration, compromising specimen volume or test accuracy. Expiration dates do not help verify identity. No expired tube can guarantee hemolysis prevention. Coagulation testing requires properly filled, unexpired citrate tubes. Question 76. A patient scheduled for a fasting lipid panel says they ate breakfast. Which action is best? Option A. Draw the specimen and write fasting on the label. Option B. Tell the patient not to mention the meal. Option C. Cancel every test without notifying anyone. Option D. Follow facility policy by notifying the appropriate person and documenting or rescheduling as directed. The correct answer is option D. Follow facility policy by notifying the appropriate person and documenting or rescheduling as directed. Fasting status affects certain tests, so the discrepancy must be handled through policy and communication. Marking the specimen as fasting would be inaccurate documentation. Hiding the meal prevents proper interpretation of results. Canceling without communication may disrupt care and exceed the phlebotomist's role. Question 77. Why is fasting status important before some chemistry tests? Option A. Food intake can alter analytes such as glucose or lipids. Option B. Food changes the patient's legal name. Option C. Fasting makes needles sterile. Option D. Fasting eliminates the need for tube mixing. The correct answer is option A. Food intake can alter analytes such as glucose or lipids. Some blood values vary after eating, so fasting helps standardize interpretation. Food intake does not affect patient identity. Sterility comes from equipment and technique, not fasting. Additive tubes still require proper mixing regardless of fasting status. Question 78. For a medication trough level, when is the specimen usually collected? Option A. Immediately after the medication is swallowed. Option B. Immediately before the next scheduled dose. Option C. At any random time during the day. Option D. Only after the medication is discontinued for a week. The correct answer is option B. Immediately before the next scheduled dose. A trough measures the lowest drug concentration, typically just before the next dose. Immediately after dosing reflects absorption or peak timing, not trough. Random timing can make therapeutic drug results difficult to interpret. Stopping medication for a week is not the routine way to collect a trough. Question 79. During a glucose tolerance test, why must collection times be followed carefully? Option A. Any time is acceptable if the tubes are gray. Option B. Timing only matters after the last tube. Option C. Timed results show how the body responds to a measured glucose dose. Option D. The patient should eat between timed draws to stay comfortable. The correct answer is option C. Timed results show how the body responds to a measured glucose dose. Glucose tolerance testing depends on comparing specimens at specific intervals after glucose administration. Tube type does not remove the need for precise timing. Every scheduled interval matters for interpretation. Eating during the test can invalidate the glucose response pattern. Question 80. Before proceeding with the draw, which documentation is especially important for a timed specimen? Option A. The phlebotomist's favorite tube brand. Option B. Only the patient's room number. Option C. A note saying collected sometime today. Option D. Exact collection time recorded on the label or requisition according to policy. The correct answer is option D. Exact collection time recorded on the label or requisition according to policy. Timed tests require accurate collection time so results can be interpreted correctly. Tube brand does not communicate timing. Room number is not a valid substitute for collection time. Vague timing can make the specimen clinically unreliable. Question 81. Before collecting blood cultures, why is careful skin antisepsis critical? Option A. It reduces contamination that could cause a false positive culture. Option B. It makes EDTA tubes clot faster. Option C. It eliminates the need for sterile bottles. Option D. It changes venous blood into arterial blood. The correct answer is option A. It reduces contamination that could cause a false positive culture. Blood cultures are highly sensitive to skin organisms, so antisepsis helps ensure organisms detected are clinically meaningful. EDTA clotting is unrelated to culture site preparation. Sterile collection containers are still required. Skin antisepsis does not change the type of blood collected. Question 82. When collecting blood cultures with other tubes, which priority is most important? Option A. Collect cultures after gray tubes. Option B. Maintain sterility and collect cultures before non-sterile tubes. Option C. Touch the bottle tops after cleaning to confirm dryness. Option D. Use a non-sterile transfer cup. The correct answer is option B. Maintain sterility and collect cultures before non-sterile tubes. Blood cultures must be protected from contamination because false positives can lead to unnecessary treatment. Collecting cultures after other tubes increases contamination risk. Touching clean tops can recontaminate them. A non-sterile transfer process defeats the purpose of sterile collection. Question 83. If using a winged set for blood cultures, why is bottle order guided by facility policy? Option A. The order determines the patient's identity. Option B. The order prevents the need to clean the site. Option C. Air in the tubing can affect which bottle should be filled first. Option D. The order makes the needle reusable. The correct answer is option C. Air in the tubing can affect which bottle should be filled first. Butterfly tubing contains air, and culture bottle order may be chosen to manage that air safely. Bottle order does not verify patient identity. Skin and bottle antisepsis are still required. Needles are single-use and cannot be reused. Question 84. For a legal blood alcohol collection, which requirement is especially important? Option A. Use alcohol swabs for every blood alcohol specimen. Option B. Leave the specimen unlabeled until court. Option C. Let the patient carry the open tube to the lab. Option D. Maintain chain of custody documentation and use the required non-alcohol antiseptic if specified. The correct answer is option D. Maintain chain of custody documentation and use the required non-alcohol antiseptic if specified. Legal specimens require strict identity, handling, and documentation controls to preserve admissibility and integrity. Alcohol antiseptic may contaminate alcohol testing and may be prohibited by protocol. Unlabeled legal specimens break traceability. Allowing the patient to carry an open specimen compromises custody and security. Question 85. After reviewing the order, which action best supports chain of custody for a drug screen specimen? Option A. Document each person who handles the specimen from collection to transfer. Option B. Use only verbal handoff with no signatures. Option C. Store the specimen in an unlocked public area. Option D. Discard the seal after collection. The correct answer is option A. Document each person who handles the specimen from collection to transfer. Chain of custody proves who had control of the specimen at each step. Verbal handoff alone does not create a traceable legal record. Unsecured storage can compromise specimen integrity. A broken or discarded seal weakens evidence of tamper control. Question 86. Why are tamper-evident seals used on forensic or workplace testing specimens? Option A. They replace patient consent. Option B. They help show whether the specimen was opened or altered after collection. Option C. They make refrigeration unnecessary for all tests. Option D. They prevent the need for a requisition. The correct answer is option B. They help show whether the specimen was opened or altered after collection. Tamper-evident seals support specimen integrity by making unauthorized opening visible. A seal does not replace required consent or authorization. Temperature requirements still depend on the test. A requisition or custody form is still needed for proper processing. Question 87. For an infant heel stick, which area is safest for puncture? Option A. Posterior curvature of the heel. Option B. Center of the arch. Option C. Medial or lateral plantar surface of the heel. Option D. Tip of the great toe. The correct answer is option C. Medial or lateral plantar surface of the heel. The medial or lateral plantar heel avoids deeper structures when an appropriate lancet depth is used. The posterior curvature increases risk of bone injury. The arch is not an approved heel stick site. The great toe is not the standard infant heel stick site. Question 88. Why should an infant heel puncture not be too deep? Option A. A deeper puncture always prevents hemolysis. Option B. Depth determines the tube color. Option C. A deep puncture replaces the need for warming. Option D. Excessive depth can injure bone or deeper tissue. The correct answer is option D. Excessive depth can injure bone or deeper tissue. Infants have small heels, and excessive lancet depth can damage underlying structures. Deeper puncture can increase injury and does not guarantee specimen quality. Tube color is selected by test requirements, not puncture depth. Warming is a separate step used to improve blood flow when appropriate. Question 89. During a structured exam prep drill, which finger is generally preferred for adult capillary puncture? Option A. Middle or ring finger on the palmar surface near the side of the fingertip. Option B. Thumb pad for every test. Option C. Index fingertip in all adults. Option D. Little finger near the bone. The correct answer is option A. Middle or ring finger on the palmar surface near the side of the fingertip. The middle or ring finger usually has adequate tissue and less callus than other fingers. The thumb may be more calloused and is not the routine first choice. The index finger is often more sensitive and calloused. The little finger has less tissue over bone and higher injury risk. Question 90. After a finger puncture, why is the first drop of blood commonly wiped away? Option A. It contains only white blood cells. Option B. It may contain tissue fluid or contaminants that can affect the specimen. Option C. It proves the patient is fasting. Option D. It activates the tube vacuum. The correct answer is option B. It may contain tissue fluid or contaminants that can affect the specimen. The first drop can be diluted with tissue fluid or skin contaminants, so wiping it improves specimen quality for many tests. The first drop is not composed only of white blood cells. Fasting status cannot be determined from the first drop. Capillary collection does not depend on evacuated tube vacuum at the puncture site. Question 91. How can warming a capillary puncture site help collection? Option A. It sterilizes the skin completely. Option B. It removes the need to identify the patient. Option C. It increases local blood flow when used safely. Option D. It makes every specimen suitable for culture. The correct answer is option C. It increases local blood flow when used safely. Warmth can improve capillary blood flow and reduce the need for excessive squeezing. Warming does not sterilize skin. Patient identification is still mandatory. Capillary specimens are not automatically suitable for blood culture collection. Question 92. Why should excessive squeezing or milking be avoided during capillary collection? Option A. It improves all glucose results. Option B. It makes EDTA unnecessary. Option C. It prevents clotting in serum tubes. Option D. It can dilute the specimen with tissue fluid and cause hemolysis. The correct answer is option D. It can dilute the specimen with tissue fluid and cause hemolysis. Excessive pressure can alter specimen composition and damage cells. Glucose results can be affected by poor specimen quality rather than improved. EDTA is still needed when an EDTA microtube is required. Serum tubes are intended to clot and are not protected by squeezing. Question 93. When is dermal puncture commonly preferred over venipuncture? Option A. For some infants, small volume tests, or patients with difficult veins when appropriate. Option B. For every blood culture set. Option C. For all coagulation studies regardless of policy. Option D. Whenever patient identification is incomplete. The correct answer is option A. For some infants, small volume tests, or patients with difficult veins when appropriate. Dermal puncture can be useful when only small volumes are needed or venipuncture is difficult. Blood cultures usually require sterile venipuncture collection and adequate volume. Coagulation testing has strict specimen requirements and is not automatically dermal. Incomplete identification must be resolved before any collection method. Question 94. A child begins to pull away during a draw. Which action supports safety? Option A. Continue while the arm is moving. Option B. Pause if needed and obtain appropriate assistance for safe positioning according to policy. Option C. Scold the child until they stop. Option D. Ask another child to hold the arm. The correct answer is option B. Pause if needed and obtain appropriate assistance for safe positioning according to policy. Safe positioning prevents sudden movement that could injure the child or phlebotomist. Continuing while the arm moves increases injury risk. Scolding is not therapeutic and can escalate fear. Another child is not appropriate assistance for a procedure. Question 95. In a routine phlebotomy scenario, which explanation is best for a young child before a fingerstick? Option A. Tell the child nothing will happen. Option B. Use detailed adult medical terminology. Option C. Use simple honest words such as a quick pinch and explain what they can do to help. Option D. Promise a toy only if they do not cry. The correct answer is option C. Use simple honest words such as a quick pinch and explain what they can do to help. Age-appropriate honesty helps the child understand and cooperate without unnecessary fear. Saying nothing will happen is misleading. Complex terminology can confuse or frighten a young child. Tying a reward to not crying can shame a normal fear response. Question 96. For an older adult with fragile veins, which technique is most appropriate? Option A. Slap the site hard to make veins appear. Option B. Use the largest needle available. Option C. Leave the tourniquet on for several minutes. Option D. Use gentle anchoring and consider a smaller needle or controlled collection device. The correct answer is option D. Use gentle anchoring and consider a smaller needle or controlled collection device. Fragile veins need careful stabilization and equipment that reduces trauma or collapse. Slapping can injure delicate skin and is unprofessional. A large needle can worsen trauma. Prolonged tourniquet time increases hemoconcentration and bruising risk. Question 97. Why should adhesive bandages be used carefully on some older adults? Option A. Fragile skin can tear when adhesive is removed. Option B. Adhesive changes the blood type. Option C. Older adults never need pressure after draws. Option D. Bandages prevent all anticoagulant bleeding. The correct answer is option A. Fragile skin can tear when adhesive is removed. Aging skin may be thin and easily damaged, so pressure wrap or gentle dressing choices may be needed. Adhesive has no effect on blood type. Older adults still need pressure until bleeding stops. A bandage does not eliminate bleeding risk, especially with anticoagulants. Question 98. Before assembling equipment for a troponin draw, which item should be checked? Option A. Only the color of the chair. Option B. Tube type, expiration date, needle safety device, and requisition requirements. Option C. The patient's favorite beverage. Option D. The brand of wall clock in the room. The correct answer is option B. Tube type, expiration date, needle safety device, and requisition requirements. Checking supplies before collection helps prevent wrong container use, expired tubes, and safety device problems. Chair color has no role in specimen acceptability. Favorite beverage is not part of collection equipment verification. The wall clock brand does not confirm correct supplies or orders. Question 99. For a thyroid panel collection, which sequence is safest after blood has entered the final tube? Option A. Withdraw needle with tourniquet tight and no gauze ready. Option B. Activate safety device before removing the needle from the arm. Option C. Release tourniquet, remove tube, place gauze, withdraw needle, activate safety device, apply pressure. Option D. Remove the needle and recap it before pressure. The correct answer is option C. Release tourniquet, remove tube, place gauze, withdraw needle, activate safety device, apply pressure. The final steps should reduce venous pressure, prepare for bleeding control, and secure the sharp immediately. Withdrawing with the tourniquet tight can increase bleeding and bruising. Most safety devices are activated after withdrawal unless the device instructions say otherwise. Recapping a contaminated needle creates sharp's injury risk. Question 100. To protect patient safety, which action should occur before leaving the patient after venipuncture? Option A. Leave while blood is still oozing. Option B. Tell the patient to remove the bandage immediately. Option C. Dispose of sharps after walking to another room. Option D. Confirm bleeding has stopped and provide appropriate post-draw instructions. The correct answer is option D. Confirm bleeding has stopped and provide appropriate post-draw instructions. Post-draw assessment helps prevent bleeding, bruising, and delayed complications. Leaving active bleeding unattended is unsafe. Immediate bandage removal can restart bleeding. Sharps must be disposed of promptly in the collection area.